Hello, everybody, and welcome to the Measuring Post, a place where we can learn and grow together. Joe Massey here, and we're going to do things a little differently today. We had some technical hiccups, but we also decided to do an audio only version for today's podcast. And that is because my guest, Dr. Georgianna Donadio, who is the founder and program director of National Institute of Whole Health, also a medical educator. She's got over 47 years of experience in teaching, research, and medical practice, but she's going to be doing a lot of research, reading a lot of really important notes for us today. So audio is the way to go. But I would like you to please give a warm welcome, Dr. Georgiana Donadio. Welcome to the Measuring Post. Thank you so much for being here today.
Thank you so much, Joe, for having me. It's my pleasure.
Yeah, absolutely. I'm excited to learn a little bit about what you do, but you really help people find their whole person care. It's about patient empowerment, reclaiming control of our health, which obviously it's the new year, new me, a lot of people going through their New Year's resolutions. This is a great time to sort of revisit those health practices, but a lot of us fall off really easily and quickly in the beginning of the year. So it's going to be great to get some insights on what we can do, how we can take control of our health, and the best ways to live our most important life. So please tell me a little bit about the background on what got you into the National Institute of Whole Health.
Well, I have a passion for natural healing and prevention. I've been in medicine for 60 years, spent a long time working in hospitals with patients, doctors' practices, nursing homes. And one of the things that really has stuck with me is observing how people are not aware. They're not informed, they're not aware, they're not empowered how to understand what they need to do to take care of themselves. Everybody's different. You can't tell everybody the same thing and say that's how you do it. Every person has to really find out for themselves and learn, what do I have to do to help me? There are so many variations to health and to what makes people well and what makes people sick. So I have a passion for this. And I've been doing it for a very, very long time, and I know it makes a difference in people's lives, and that's what excites me, is that you could give people the skills and the tools to really totally control and change their life, and um, isn't that what it's all about?
Yeah, absolutely, and you're 100% right. There is no cookie cutter format for health. You know, what works for one person might not work for me or you, and it's really important to dive deep into those metrics to truly understand not only your medical history, I would imagine, but your body and how you react to certain things and different stressors and different diets and all of the things that go into that. And something I'm actively as I get older paying more attention to, not only family history about, what to look out for, whether it's heart attack or stroke or diabetes, but also just seeing some of the things that I do and consume in my daily life and how I can streamline and optimize those to really give myself the best chance of a long and healthy life. So I love what you're
Wow.
doing and looking forward to learning more about all of the great stuff today.
Well, what I want to do today is I want to marry two important factors. One, what you were talking about. What do I need to know? How do I take care of myself? But very profoundly important in today's medical environment. One third, the third leading cause of death in the United States will shock a lot of people. It's not a disease. It's not gun violence. It's not drug overdose. It's not car accidents. The third leading cause of death in the United States is medical error. Okay. And why is that important? Because all of us, vast majority of us are going to come across situations where we have got to be well informed. We've got to know how to advocate for ourselves, what we are willing and are able to deal with and tolerate and take as far as care is concerned. I want to tell you, it's got to a shocking point when a third of the deaths that happen in the United States are caused because of an error. And what are those errors? I mean, what kinds of things can happen? Well, there's a time constraint, and there's no time to truly investigate or to truly diagnose. There's a complexity of the condition that isn't being explained and explored. The medication is huge. More people are dying from the wrong dose, the wrong medication, and complications that they're having with other situations and other conditions in their life. There's also a communication problem. Terrible. Doctors, nurses, hospitals not communicating well. The records of people are not being, noted properly. And when you have a person in your family that you love who dies that way, that could be very discerning. And I want to tell you, Jake Tappa, most people know who Jake Tappa is. Uh, his daughter almost died 3 years ago from this exact thing. And the gentleman from General Hospital, Anthony Garda, who was the lead at General Hospital, he died shortly after surgery from, guess what? Complications that were based on medical error. So when we look at, I could tell you other names like Brittany Murphy, John Ritter, um, Bill Paxton, Chadwick Boseman, all of these people, they all experienced this. Maybe they weren't diagnosed properly. I know John Ritter, when he got to the ER, he wasn't diagnosed properly. And Chadwick Boseman, he was saying for a long time, "Look, I'm not well. Something's going on." They didn't pay attention. There's a lot of things that go on in the course of medical care that is jeopardizing your health. And my passion is getting people to understand, look, everybody wants to live to be 100 today, okay? My father actually lived to be almost 102, and he died because of an accident at the senior, what do you call it? Living, was the senior living where he was. But the truth of the matter is, you can't live to be 100 if you can't know how to protect yourself, take care of yourself. I mean, exercise is great, nutrition is great, and all of that stuff is wonderful. But that's not usually what kills people, is, the lack of that. What kills people is day-to-day issues and not understanding how to protect yourself, how to look out for yourself, and how to take care of yourself. So I hope that's of interest to your audience.
Yeah, no, it definitely is, and I've seen both sides of this. We actually just had a very dear friend of mine who passed away from cancer, and he ended up with stage 4 that metastasized all through his body. But they really, his medical team, in my opinion, really dropped the ball for him, and he felt that way. Like they were pushing tests back and things that really allowed some of these cancers to spread much further and quicker because they were pushing, very important sort of doctor meetings with him and testing back to a level that was way too far, down the line. And it really let this sort of grow and build in him. Now, I don't know if if they would have moved faster, if it would have given him more time, but certainly that was something that he believed truly in his heart was an issue. But, you're right. It's the day-to-day stuff that we tend to ignore, like your high blood pressure or your bad cholesterol. And these are things that I'm starting to really take notice of as I get older. But I would imagine that the individual themselves oftentimes is part of the problem where they go, well, I feel fine, so I'm not going to go get anything looked at, or I don't really need to bring this up. I'll just tough through it. And I think men are probably a little more guilty of that sort of behavior. I know that I certainly am as well, but you do have to be an advocate for your own health because nobody is going to do that for you.
Absolutely. And what my program does, you can go on our website, you can get a free handbook that we put together about how to be your own advocate, okay? You can take a course, very, inexpensive course that's more extensive. It has more education in there that you could do for patient advocacy. And we even have people who you could take a professionally accredited program that will allow you to become board certified as a patient advocate. So we're serving on all different levels. And I want to encourage people, please, please, please become educated about how to advocate for yourself and your family. I cannot tell you. I mean, the last few years I was in my medical practice, I practiced as a patient advocate because I kind of transitioned from the work I was doing with people, which was integrative healthcare, and I transitioned into patient advocacy. And ironically, uh, the thing that was so interesting about this is that most of my patients, for some reason, were men. And I don't know why it turned out that way, but I would be able to help them. They were all, most of them were surgical patients, and I was able to educate them, help them, put them in a perspective of understanding of what their expectations were, what they had to do. And there's a program called Prepare for Surgery, Heal Faster that was done by Peggy Huddleston, very brilliant lady, and really prepare them in a way that they felt good and they felt that they had done the most that they could. And I would be able to walk them right up to the theater or to the operating room, and I would go with them. I would talk to their doctors. Their doctors knew they had an advocate, and guess what? They all said to me, they said, you can't imagine the difference between the way it was before I had an advocate and the way it is now. When you have an advocate, and doctors know and nurses know somebody's watching, somebody's listening, they are on their toes. And it's very important to understand that because the medical professionals, they are overwhelmed, overburdened, burnt out. Most of them, many doctors are leaving. Either that or, unfortunately, they're committing suicide. I'm sure you're aware of that at a pretty high level, pretty high rate. Alcoholism, addiction, suicide, certainly things like divorce and other, traumatic, stressful situations. So we have to understand medicine is at an all-time level of crisis. It's really unfortunate. Now, we're very lucky in the United States because we happen to have excellent, excellent, excellent technical medicine. And I emphasize the word technical medicine. Now, the Kaiser Family Foundation, they've reported, the summary is that the U.S. excels in creating new medical technology, but in healthcare systems, the cost and the complex structure affect the overall patient outcomes and affordability, making it a leader in innovation, but not a leader. We are kind of losing on the actual healthcare performance side. We are dropping down in the world in terms of how patients experience outcomes. Do we have excellent medicine? Yes. Do we have great technology? Yes. And if you want, the best that you could get as far as diagnosis is concerned, diagnosis is easy. It's not the diagnosis, is what's happened. What happens after you get the diagnosis? What's done about it and how is it done? So I don't like to scare people. I don't like being afraid. And when I, had to address healthcare, I didn't want anybody scaring me. But I say to people, look, don't be afraid, but be aware. It's your life, it's your health, it's your wellness. And many people are crippled and disabled because of medical error.
Yeah, absolutely. And if you're just joining us here on the Measuring Post, I'm speaking with Dr. Georgianna Donadio. She is the founder and program director of National Institute of Whole Health. And I think you've hit on a couple of topics that are really important. There is this sort of underlying level of fear that goes with understanding health. But I think a better way to frame it is you just have to know this information. You don't want to run away from things and, do the old adage of, the head in the sand sort of mantra where if it's out of sight, it doesn't exist. You really need to understand the way that the health system works because at some point or another, whether you like it or not, you are going to have to deal with this health system, whether it's your health, a family member's, a spouse, a parent, God forbid, a child. These are things that you need to understand how to navigate. But I really want to ask a few questions about what does it mean to you, like whole health? You hear the phrase whole health. Is that like Eastern and Western medicine meet, or are you talking mind, body, spirit, soul? Sort of, what's the difference between like a whole health approach versus more of like symptom based care?
Sure. Back in 1976, my organization started. This is the 50th anniversary of the creation and the hospital research that we did on whole health. Now, when we created this model, whole health was about providing for people physically, emotionally, nutritionally, environmentally, and spiritually the information they needed to take control of their life and their health. What has happened 15 years ago, the Veterans Administration liked our model and took it for their own. But what they did with it is they turned it into an integrative medicine model. Now, if you ask me, a lot of people call me the mother of whole health or the grandmother of whole health. But if you ask me what it means is you are a complex human being. There are 5 basic categories that you have to pay attention to. The first one is your physical body. The second one is your environment. People have no idea how huge your environment is and how it affects your health. The third, of course, is your nutrition. It's important, but it's almost not as important as understanding your environment. The other thing, of course, is the psychological. Huge, 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 huge. Most of us come from some form of trauma, either in our childhood, in our lives, some experience of trauma. And that sits in your unconscious and totally dictates your behavior and your choices. And last but not least is the spiritual. So in creating this model, my goal was to say to people, look, you could break this down. We can help you do it. It's not that complicated. This is in your lap because it's your life, it's your body, and you can do this. All you need is information. So we created an information model. That's why I'm a medical educator, and that's what I do. I educate people. And that's what you're absolutely right, Joe. People need information. The difference between whole health and allopathic or whatever, it's a common sense thing. There's nothing complicated about it. Whole health means look at your whole life. You're a whole person. There are a lot of people, their life is really together, but they have a problem in one area. You can have a problem in one area, and 2 areas, and 3 areas. If you've got the information, you can make the changes. If you don't understand it, you're dancing in the dark.
No, I absolutely love what you're saying, and it makes so much sense. And when you explain it like that, it sounds so simple, yet I don't know, humans, we have this inherent ability to make things really hard when they're not. And I know I'm definitely guilty of seeing something that should be really simple to accomplish, and I just throw up all these red flags and cones in the way that make it harder for myself. But what's some practical ways that people can really sort of advocate for themselves? Obviously, education is going to be the strongest form of prevention, but I would imagine making sure you're asking the right questions, really understanding your options, being a little slower to make decisions. We like this instant gratification. But since you've been doing this going back to, 1980 when you were really doing the hospital researcher side, what have you seen as some really practical ways that patients can advocate for themselves? And what sort of do you see a shift that's more towards prevention instead of like being reactive?
Sure. That's a good question, Joe. Now, here's the thing. I want to just tell everybody right now, and this is a big deal, and it's related to the topic. We are living 4.1 years shorter. We have a shorter life expectancy than comparable countries. That's a big deal. It's a big deal when you're in a country that everybody's obsessed with living to 100. I've never seen anything like it. And the last year, everywhere you go, it's all about longevity, living to be 100. And I want to be honest with you. I'm an SBI. I'm a full-blood Italian, and my family's from Sicily, where the blue zones. Uh, Even if you have strong genetics and strong, training and habits, that isn't enough to have a long lifespan because we are bombarded by so much cell phones, the air, the water, the environment, the stress. We're just overwhelmed. Our bodies, our minds are overwhelmed by what's going on in our environment. So when it comes to what can people do, here's what you have to do. You have to sit down and you have to put your fear aside. Put the fear aside. Don't worry. It'll all work out okay. And you say to yourself, okay, let me take an inventory. Let me take a look. I have um, this one exercise I have women do all the time, but men can do it too. Write down on a piece of paper, on a pad, all of the things that you're putting in your body, on your body, or that your body's being subjected to. That's the physical aspect. You cannot believe the thousands of things. I mean, if you just think about it, you get up in the morning, what do? What do you put in your mouth? What do you put under your armpits? I mean, all the stuff we put on our body before we even get to eat breakfast, which is usually inadequate. So when we sit down and we make a long list, what are the physical things in my life that I'm dealing with? What are the environmental factors? The work environment, the home environment, the family environment. What are the nutritional factors? Then you have to take a look, of course, at your spiritual. What are your attitudes? Americans, we're really interesting people. We're very competitive, and we're not Buddhists. Okay, I mean, we're not chill, and we're not allowing our experiences to educate us. So when we start to take a look at physical, emotional, nutritional, environmental, and spiritual, when we start to look at those different things, I had a gal, I'm going to tell you this briefly. She's a patient, a nurse practitioner came into my program because we educate nurses and doctors and as well as the public. She came into the program with a stage 3 cancer diagnosis, breast cancer diagnosis. And I said to her, oh, I'm sorry to hear that. I said, may I ask why you're taking this program? She said, yeah, I want to know how to take care of myself. And here's this, nurse professional. She said, I don't know why I got this, and I want to know what to do about it. I said, well, I said, if you take this program, when you graduate, you will know why you got cancer. She said, that's impossible. Nobody can tell me that. I said, I'm sorry, but, we've got a lot of studies and a lot of information we can give you and explain to you why. Why is that important? Because once she knew why she got cancer, that was many years ago. She is now a spokesperson for the American Cancer Society. She's a well-known, she's like a celebrity in the field. She has spent the last 18, 20 years clean as a whistle, healthy as a horse, and very happy. And this is what she does with people now. She educates people. So the bottom line is you have to know. You have to know why and how so that you can reverse it. If you don't understand that, you can't change it.
Yeah, that's a powerful story and definitely a lot of truth to that. If you're just joining, I'm with Dr. Georgianna Donadio. She is the program director and founder of National Institute of Whole Health. And I want to touch on another thing because not only are you this great medical educator, but you also do a lot of work in relationship and communication. And you actually have a best selling book called Changing Behavior, Transform Your Relationships. Now, this is one of those things I think people probably overlook when they're considering their physical health. But how does the stress and communication breakdowns and sort of the unresolved conflict have an impact on your physical body as well from your relationship standpoint? Can you dive into that a little bit?
It's so easy. It's so simple. We want to be seen and known and heard and loved. How can you do that when you're not sharing your words, your feelings, how what you want from life, what your desires are? We don't communicate well. It's fear. It's always fear that holds people back. This book that we wrote and put together, it's been hospital studied. We have hospital studies on it and everything, 100 yards. And the thing of it is, when you, and doctors are now using this with their patients, when you learn how to communicate in a way that is truly and authentically sharing you and, and listening to the other person, you have a very different experience. Communication is everything. If you don't have good communication, you can't have a good relationship. I just want to interject here for 1 second. We have free workshops. We have free online courses and things that you can take. If somebody wants to avail themselves of any of this, just go to our website at NIWH, is for National Institute of Whole Health.org. Just go. There's a lot of free stuff on there, and we're very happy to invite you to our webinars, our once a month health webinars. So feel free to do that. I'm sorry for that little commercial, but I wanted to get that out.
No, no, absolutely. Please do more of that, and I will make sure to include the links everywhere when we release this interview, because it's important to know not only the information you're sharing verbally, but there is actual downloadable resources and courses and templates that you can use and access right away that can really help you take this from idea to ideation to actual practice in your daily life. So, no, no, no. Please feel free to mention that again, and I'll touch on that as we get a little closer to the end of this. But you're right. It's important for us to understand not only our options physically, but putting yourselves in great environments that benefit you. But that includes relationships and, not having stress beat you down and not being in a negative, toxic environment, because those things definitely can eat at you from the inside out. So, no, I think it's a very important lesson that a lot of people, unfortunately, they either don't learn it or they learn it far too late into the game where a lot of damage has already been done. So that's a really valuable tool.
Well, I'm just going to suggest this. Look, I'm a grown up. I have three children. I've been married a couple of times. I've been around the block. Okay. And I just want to say the biggest handicap for all of us is our relationships. And that's a fact. I mean, you can look it up. Well, what is the biggest kind of stumbling block in your life? It's your relationships. If you look at Maslow, it's, first you have to survive. You've got these different levels of survival and adaptation, and then finding shelter and being protected and having a home and all of that. And after that, after the first two levels, the third one shows up, and that's relationships. That's belonging, the belonging with other people. And of all the areas of our lives that is problematic is relationships with other people. Why is that so? Oh, I could talk about it forever, but I'll just briefly say it's the way we're raised. It's the way our brains are conditioned to believe what relationships are and how we should, conduct ourselves. And the third, and this is really big, we're human beings. We have egos. It's perfectly normal to have an ego. But our egos, unfortunately, are not well developed in a positive way. And I want to criticize this as something we as Americans do, because we're very competitive. Everything is competition. Who's winning? Who's number one? Who's the prettiest? Who's the smartest? Who's making the most money? We don't have a healthy relationship with ourselves. So what happens is, because we're criticizing ourselves and comparing ourselves and, saying, oh, I'm not as, rich as Dave, or I'm not as pretty as Mary, or whatever. We have got to learn to love ourselves in a functional, healthy way. And then we can have wonderful relationships with other people.
I absolutely love that. And that is so important. And, they say comparison is the thief of joy. And there's a couple other variations of that. But so true. You can't look at what your neighbor has or what they have more money. They've got a nicer car. Yeah, he's taller and stronger and more handsome than me, which is true for a lot of people. But, it doesn't mean any, declassifying your value. Those are things that you were not able to control. You have to find comfort in your own skin, in your own world, and just find value in yourself. You are more than enough. And when you compare yourself to these Instagram models and these celebrities in Hollywood, it's meant to make you feel bad because they're glamorizing things that they probably don't even experience in their own day-to-day life. So, it's really easy to get caught up in this ideology of, well, I have to have the best of everything and be number one in everything, but it simply isn't the case, and it's not feasible. You're never going to be number one at everything, and to even want those things is probably a drain on your social battery and your sort of internal health, anyways. When you're constantly desiring and never happy with what you have, you're really being toxic to yourself. So I love that that's sort of the mantra and the mentality that you're having. And I love, when you first wanted to, reached out and were requesting to be a guest on our show here. I love that you're a nationally syndicated radio host because I'm a longtime radio guy. So I wanted to bring that up because this great information that you're sharing on this interview can also be heard on your radio show, which is called Living Above the Drama. So where can people tune in to continue to learn from you and get your great message every day?
Okay, well, what I would say is living above the drama. What a blast I've had doing that, and just interviewed some amazing people and shared a lot of good information. As far as currently is concerned, I am running all those interviews, but I'm doing new interviews, and I'm really working very hard to extend the free information to people. So my focus right now is getting information out to say, look, we'll give this to you. It won't cost you anything. Please consider this. We want you to live. We want your children to live. It's very frightening to realize that. And this is. I want to give you a statistic which will kind of blow your mind. I know it blew my mind when I read it, and all of this is coming from the National Library of Medicine. There are 155 million ER visits. This is from the Center for Disease Control. 155 million emergency room visits. Out of that number, 7.5 million are misdiagnosed. Do you understand what that means? That means that you have a really high probability. I could tell you stories on top of stories on top of stories about people. My own daughter, when she was in college, they misdiagnosed her. She had pneumonia, and when I spoke to her, and she told I drove over to the college, grabbed her out of school, and brought her home and brought her, to the hospital. She had a very bad case of pneumonia, and she could have died because she was getting sicker and sicker. And she kept going back, to the student services, and they said, "Oh, you're fine, you're fine." The whole idea is, I want people to know, if you have a desire to learn more, you could come to our free webinars once a month. They're going to be live. We'll also make them available to you. You can learn that way. You can take some free courses. You can read some of the books we recommend. But by all means, make a commitment to yourself that you are the most important thing in your life, because you are your health, your safety, your life. So feel free to contact us. You can listen to Living Above the Drama. I mean, you can go to livingabovethedrama.com. You can go to iHeartRadio. It's in a couple of different places, and you can listen to those interviews. We did a lot of them, and they were really, really, really interesting.
Yeah, no, that's great to know. And again, you guys can find her on her website as well, which is the institute is called Whole Health, National Institute of Whole Health.
Institute. Yeah, and it's www.niwh.org. And you can certainly, if you want to, you can email me. It's my name at Gmail, Georgianna, Georgianna at Gmail. I'll be happy to answer your questions. If you have a burning question, I don't treat people by phone or anything. But if you have a question, if you need a direction, if you're looking for help, we want to help you. We don't want to see. I hear tragic stories, and I've seen tragic stories in my many, many years in medicine. Young children, young parents, young men and women dying that didn't have to die. So if you have a question, if you have a concern, please call or write or contact us, and we'll be very happy to help you.
Yeah, absolutely. Don't become a statistic, especially one that's as daunting as the one you just shared, because this isn't like getting the wrong order that you ordered from Uber Eats. This is your health and your livelihood. So make sure that you're going in with the right education, the right information, advocating for yourself. But that means also understanding what you're doing to your body including the things you put on it, the things you put around it, and the relationships that you allow with inside of it. So I love the content that you shared. This is giving me a lot to think about. Definitely will be sharing your contact information on LinkedIn, niwh.org. Again, we'll put links around that. This is such a valuable resource and something that we haven't really covered on the measuring post, but there's such value in this because it's one of those things that we're all going to have to experience. And the more prepared you are to go into a conversation about your health, the better decisions you can make for your health, and the better likelihood you're going to avoid some sort of catastrophic mix up that probably could have been avoided if you simply advocated for yourself a little more. So, Dr.
Absolutely. And
Georgianna,
I just want to say one last thing. People spend more time researching the car they buy than the medical advice and care that they're getting. So that's just my little last comment. Please, please bear that in mind.
100%. Yeah. So definitely reach out to the great people over there. That's going to be the National Institute of Whole Health. We'll share links to that. But this has been a fantastic conversation. Would love to keep the momentum going. Please let us know when the next webinar is. Not only would I personally like to attend one of those, I would love to share that with our audience so that they can actually get a firsthand experience about sort of how you guys present the information. Make sure to go to the website, download some resources, and ask questions. Please and thank you for that.
Absolutely.
Yeah, Dr. Georgianna Donadio, you are a rock star. Again, thank you so much for your time here today on the Measuring Post.
It's my pleasure, Joe, and you take good care. Stay warm.
Absolutely.